Health Minister Moses Jn Baptiste addressed criticisms from the opposition United Workers' Party regarding the recent handover of St. Jude's Hospital. The UWP accused the government of prematurely handing over the state-of-the-art facility without full operational readiness. Speaking on the Zafenu program, Baptiste countered by citing the commissioning of the Owen King European Union Hospital, noting its dialysis unit opened years before the main hospital. Baptiste also recalled the sudden 2020 relocation of Victoria Hospital's services triggered by the COVID-19 pandemic and the lack of commissioning between 2016 and 2020.
Moi, comme ministre santé, c'est pour mettre job ici qui avant nous finissons l'hôpital St. Jude qui fini. Avec à présent l'hôpital St. Jude fini avec nous chiffre ces départements department by department, qui c'est ça, même ça, Alan Chassney fait. In fact, nous avons fait primaire parce que ça a été fait. Only dialysis avec yon when the administration by in 2018, as lot any patients as a ward la in 2018, as whole OKEU they occupied in 2018. C'est ça mon ça. OKEU was occupied in 2020. When the COVID-19 pandemic forced the UWP government to shift the hospital from Victoria to OKEU. In 2020 and in 2018, there was a dialysis unit which was shifted from Victoria to OKEU. So I want the UWP to explain that, explain the difference. In fact, we are doing much better. And what I can promise the people of St. Lucia is that when we win the next election, the government of St. Lucia will continue to improve the health infrastructure and will continue to improve the health services.
Separately, the St. Lucia Medical and Dental Association, SLMDA, in a DBS TV interview reproduced in snippets on private social media pages, expressed disappointment over not being invited to the St. Jude's handover ceremony. They also voiced some concerns about the commissioning process.
Unfortunately, we weren't invited to that. We're not quite sure if that was an oversight or if this was an issue that this wasn't seen that we weren't important enough as a stakeholder to be invited, but we weren't. There were individual physicians, of course, who were invited and the staff of St. Jude, but the St. Lucia Medical and Dental Association as such was not. There's a certain amount of disappointment among members, and I think among citizens of St. Lucia also, that we're not getting a hospital which is allowing not only our members down at St. Jude, but I mean St. Lucians, the patients, the nurses, and other workers at St. Jude's to be able to move immediately into the new building. So our understanding is that the equipment is not yet there, and that's why that can't be facilitated. And of course, the whole debate about the commissioning of the hospital, how long that will take, we're not quite sure of those details, but we are hoping that that could happen sooner rather than later.
Prime Minister Philip J. Pierre did apologize to the Medical and Dental Association. The Health Minister added that while he was not aware of the SLMDA's remarks, the incumbent government retains a good working relationship with the professional fraternity.
Well, Mokowe statement avec maga respond to abagay Mokowe, so na ale gade statement ek na read statement pour qui ça qui fait. So maga
Apushua.
Moi suppose that journey from different muna gouvernement. So nous n'y a un bon working relationship avec Medical and Dental Association. Just recently, Premier Minister had a meeting a few weeks ago with Medical and Dental Association. Nous avons meeting a cabinet avec Medical and Dental Association. Nous avons before discussion avec Medical and Dental Association avec n'importe question ou bien n'importe bagaille Medical and Dental Association or the St. Lucia Nurses Association, n'importe question yo ni, n'importe bagaille yo vle suggest ou bien n'importe bagaille yo kwe pite de pour faire en l'autre manière, moi savent nous écouter parce que comme Premier ministre l'a toujours dit, nous travaillons avec tout professionnel.
The minister's remarks come as St. Lucia prepares for the December 1st general election, with healthcare remaining a key campaign issue. The government has invested heavily in St. Jude's, aiming for full operation in a phased approach. Joachim de Plessis, HDS News Force.